Hello and welcome to the Patient Education series. My name is Christian, I'm an optometrist, and the aim of this series is to provide some information in plain English to those who want to know more about common eye conditions. Perhaps you've been told that you have cataract, glaucoma, or macular degeneration, and you're not quite sure what that means. Or perhaps you want to support a relative or friend. My hope is that after watching these short videos you'll have a clearer understanding of various eye conditions and I'll offer some helpful tips to support you. I welcome your suggestions for any topics you'd like me to cover in the future. And if you find this video helpful, please subscribe so that you're kept up to date as new videos are released. In this episode of the Patient Education series, we're going to talk about cataract. In a nutshell, a cataract is not a film growing over the front of the eye. It's actually a clouding of the lens inside the eye. As the lens becomes more cloudy, usually with age, the vision becomes more blurry. The only way to treat cataract is to have surgery. The operation is usually quite straightforward and it has a very high success rate. For those who want to know more about cataract, I'm now going to go into a bit more detail. Let's start off with some basic eye anatomy. This is the front part of the eye, and as I said, it's not a film growing over the front of the eye. It's actually a clouding of the lens inside the eye. You can see the lens has been highlighted here. And in normal day-to-day life, light travels through the front of the eye, through the lens to the back of the eye, which allows us to see. In a cataract, the lens becomes more cloudy, and as a result of that, less light can get to the back of the eye, so the vision is more blurred, more washed out, and essentially less clear. This 3D image of the eye quite nicely shows the lens here sitting behind the coloured part of the eye, the iris. So in this case it's a blue eye, but you can see it's very much inside the eye, not at the front of the eye. The process that happens with cataract formation is a bit like when you fry an egg. So the clear part of the egg becomes gradually more cloudy and eventually it becomes white. And the same process happens in the lens with cataract formation. When we're young, the lens is clear, it gets gradually more cloudy with age, and if we left it long enough, it would be so cloudy it would be completely white and we wouldn't be able to see out of the eye at all. There are several different types of cataract and the details don't really matter too much, but I just wanted to show you what we see as an optometrist when we look at your eye. So you can see here this cloudy part in the centre, this is cataract. A different type of cataract here with these little spokes, a bit like spokes on a bicycle wheel. And again a different type of cataract with this cloudy part right in the centre here. So what do you as a patient notice when you have cataract? Well, the commonest one is that your vision becomes more blurry, more cloudy, more hazy, less clear. Also, colours can appear more washed out, and people often complain of more glare because as the light is coming into the eye, it gets scattered by the cataract and people see that as glare, both at night time and during the daytime. As I mentioned, cataract is part of the normal aging process. It's a normal aging change in the eye that we all get if we live long enough. But there are some things that put us at an increased risk of cataract. For example, an eye injury, somebody taking steroids, particularly a high dose of steroids for a long period of time. Certain types of eye surgery can actually cause a cataract in the long term. And those who smoke or have lots of exposure to UV light, so spending a lot of time outside, and also diabetics do tend to get cataracts a bit younger in life. So two simple things you can do: if you smoke, try to stop, go and see a smoking cessation service, and if you're going outside, put on some good UV safe sunglasses as well as a hat with a peak or a brim so that less sunlight is getting into your eyes. Let's talk a bit about eligibility for NHS funded cataract surgery. And there are two main aspects that we look at. The first one is how well can you see on your optometrist's test chart. This is called your visual acuity. If you can easily read the letters right at the bottom of the chart, those really small letters, then you're less likely to be eligible for cataract surgery than if you're struggling with even the largest letter at the top. and most local NHS organisations set criteria which are somewhere around the middle of the test chart. So when your vision's reduced to that level, you're probably eligible for surgery. The other thing that we look at is how the cataract is affecting your quality of life or your ability to do normal daily activities. So this could include your ability to work, particularly if you do very fine work such as a watchmaker. Is it affecting your ability to do sports or hobbies, watch television, or is it putting you at an increased risk of a fall? All of these various factors help to justify having the surgery funded by the NHS, and your optometrist will talk to you about the local criteria in your area as to whether or not you meet those. So if you're eligible for NHS funded surgery, that doesn't necessarily mean that you're going to put yourself forwards for it. You have to decide when the right time is for you. But do be aware that the longer you leave it, the more blurred your vision will become. And if you leave it for many years, it can make the surgery a little bit more difficult too, so a slightly higher complication rate. As I mentioned earlier, the surgery is reasonably straightforward, reasonably quick, and it does have a high success rate. The process itself, please remember I'm not a surgeon, but typically on the day some drops would be put into the eye to numb it. Sometimes an injection is given just near the eye to numb it. The cloudy lens, which is where the cataract is formed, is removed, and an implant is put in its place. Now the surgeon will look at the power of your glasses, and they can actually choose the power of the implant to match your glasses. So if all goes well, your distance vision typically would be clear without any glasses, or perhaps with just a very small prescription. That's assuming things go well, and you need to have that discussion with your surgeon. The process itself, well, you'll probably be in the hospital for half a day, you'll probably be in the theatre for about half an hour, and of that time, probably only about 10 minutes is actually having the operation done itself. After surgery, you'd be given a clear eye shield to wear, usually for the first 1 to 2 days, and you'll be given some eye drops to use, typically for 2 to 4 weeks. They will help to reduce the chance of an infection and also to control any inflammation. There are some things to avoid following cataract surgery. You don't want to disturb the eye by rubbing it, and you don't want to get any chemicals in the eye, so soap, shampoo, swimming, or eye makeup. And you're usually recommended to take it easy for the first week or two, so strenuous exercise and housework to be avoided, so sounds like a good opportunity to put your feet up. And normally about a month after surgery, you'd go and see your regular optometrist, and they can discuss whether or not a change of glasses is necessary. Almost always the power in the eye that's had the operation will be different following cataract surgery, so it's worth bearing that in mind. Thank you for watching this short video on cataracts, and I hope you found it helpful.